Matthias Rath is a German pharmaceutical proprietor who claims that micronutrients alone treat AIDS. He claims that antiretrovirals, the treatments recognized by every competent medical authority for treating HIV and AIDS, are toxic and make AIDS worse. He makes similar claims for heart disease, cancer, diabetes, and other diseases. Rath has conducted unauthorized and illegal clinical trials in Khayelitsha and other areas in the Western Cape. These trials involve making false claims to prospective patients that vitamins reverse the cause of AIDS, taking blood samples from patients, taking photographs of patients semi-naked for the purpose of before and after photographs, and distributing unregistered drugs to patients. Siyayinqoba spoke to Dr. Andrew Bull, who recently got over 150 healthcare workers to sign a protest against Dr. Matthias Rath.
The Rath Foundation have, since March, had distributed a number of different media, all factually incorrect and misleading materials encouraging patients to stop taking antiretrovirals and to rather take vitamins, claiming huge toxicities to antiretrovirals, and claiming that the vitamins that they were distributing were the solution to HIV. In fact, the last publication claimed that the end of the HIV epidemic is now in sight.
Not only does the Rath publication, You Can, state that ARV drugs are no answer to AIDS, but it also claims that the Rath Foundation has the support of our Minister of Health and the government. So, It went to Tshwane and asked Sibane Mgadi, the spokesperson for the Minister of Health, does the government support the Rath Foundation?
We agree on this one principle, on the use on the important role of nutrition, one, on the role of multivitamins and micronutrient supplementation. Yes, we agree on those areas. On other areas, I don't think we generally will agree, because to say antiretrovirals have no role whatsoever in the response to HIV and AIDS will not be correct in terms of government policy as it stands now.
But we were not clear, so we asked the question again. Does the government support the Rath Foundation?
We have said that antiretrovirals have a role to play. That is clear, and that's why we have made all the arrangements to have them provided. So now, if a particular organization does not agree with us on that, it does not necessarily mean that you have to denounce the whole organization, especially if you agree with the organization on other things that are very important to highlight at this juncture in the response.
Still, we didn't quite understand. So we asked once more, does the government support the Rath Foundation?
Hence I say it's not correct to say for them to claim to have support of government. They can claim that maybe government will agree with them on the issue of nutrition.
With the Rath Health Foundation encouraging patients to stop life-saving medicines in a political context that encourages or condones them to do so, is atrocities against patients, and we felt that we were complicit in that if we didn't speak out as health professionals. So we thought that if we could get 20 or 30 HIV clinicians to put their names to a letter, we might get a more definite response out of government. So we sent out this letter to the clinicians at the sites that provide antiretroviral treatment, and the response was just overwhelming. I think on the ground people feel incredibly strongly about this. When you're putting heart and soul as a clinician into providing HIV care, and your patients arrive in total confusion because of misinformation, or when they've been targeted in their homes because people have been identified as HIV infected, and agents of the Rath Foundation have found them in their homes and deliberately confused them. It's just outrageous, and people feel very, very strongly about it.
We have had the complaint about particularly the Rath Foundation conducting, as alleged, clinical trials in the Western Cape. And the decision was then to ask the Medicines Control Council to conduct its investigation.
To date, the MCC had not responded to BID's request to comment.
My name is associated with the answers to a variety of diseases. Now that the word is out that there is a natural remedy for the control of AIDS, the immune deficiency, no one can stop this.
We don't have a problem if someone gives you a supplement like vitamins and they don't stop you from taking your proven medical treatment that you're getting from the public clinic, your TB treatment, your antiretrovirals, whatever it might be. That's not a problem. Rath, however, does more than that. He stops people from taking treatment, and in addition to that, he's giving them huge unproven doses of his vitamins, and his product contains a drug called acetylcysteine, which is a scheduled drug in South Africa, and you may not distribute a scheduled drug except under specific circumstances. And he's deviating from all of those circumstances.
What's
his intention?
Yeah.
Why is he doing it? Well, he is using people in Khayelitsha and elsewhere as guinea pigs. Because what he's done is he's running an advertising campaign with them overseas. He puts his adverts up on his website, and he puts he's placed an advert in the New York Times, he's placed an advert in International Herald Tribune, he ran an advert in the Namibian, where he makes use of what he's doing in South Africa to try and market himself.